Good afternoon, good morning, or good evening, depending a little bit on where you are for the moment around the world. My name is Liesbeth De Waele, and I'm very happy to present an update on the Year 2 activities of the TANDem project. I will start with a short introductory slide to remind you of what the TANDem project exactly is about. TANDem stands for Empowering Families Through Technology, and it's a mobile health project to reduce the TAND identification and treatment gaps. So the term TAND probably doesn't need too much introduction for this audience. More than 90% of the patients with TSC experience problems, one or another of the neuropsychiatric disorder profile. And that can be at the behavioral level, the psychiatric level, the intellectual level, the academic level, neuropsychological, and or the psychosocial level. And all of these difficulties and problems are brought together under the umbrella term TAND, which was coined in 2012 at the TSC Clinical Consensus Conference in Washington, D.C. by the neuropsychiatry panel at that time. And in the next few years, a TAND checklist was developed, the lifetime version, the TAND-L, and it was also translated in many different languages. And it was used as a screening tool, mainly by healthcare providers, healthcare professionals, to screen for TAND in patients with TSC. So through the work done by Lauren Leclezio and Petrus de Vries, it became apparent and clear that that there are natural TAND clusters where you have elements from the different levels coming together, and that these clusters correlate more to daily life and functioning of these patients than the separate levels. So it's based on these on this concept of the natural TAND clusters that the TANDem project was set up, in fact. The project is led by Professor Petrus de Vries, affiliated to the University of Cape Town in South Africa, and co-lead is Professor Anna Janssen, affiliated to the University in Brussels. I'm quite sure you both, you know both of them very well. And the project is funded by the King Baudouin Foundation from Belgium, but also by the Tuberous Sclerosis Association. This is an overview of the different aims of this project. It's a bit of a busy slide, but I will go with you step by step through the different aims and where we are now for the moment. This is an organigram of how we are organized. So we have the PI and co-PI and the action group and steering group leading the day-to-day activities of the project. And then we have several other groups that are focusing on specific aspects of the project. I'm the lead of the dissemination group, and in that role, I'm presenting you our progress today. I already mentioned here the link to our website, but I will definitely come back to it later on in this presentation. So to start off with aim 1 is the development of the TAND-SQ, and TAND-SQ stands for a self-completed, a self-report and quantified version of the TAND checklist. This was a request by the TSC community, so they really wanted this screenings tool in a form that they could fill it in themselves, that they complete themselves, because not everybody has access to a healthcare professional or an expert to help them go through the TAND checklist. And they also thought it was interesting to make it quantifiable, so that you can identify and quantify the severity of the TAND difficulties experienced. And here you can see an example of how it will probably look like on paper. It's almost the final version, where you can see, for example, the first question there is, has anxiety ever been a problem? And then it can be scored or quantified from 0 being not at all or 10 extremely, and there's also some space for extra comments or other elements that need to be discussed. So we are finalizing this, the TAND-SQ, and then it will be integrated, or it is being integrated into the app that is the innovative product coming out of this project. So as you can see here on the second panel, when you register for the app and you log in, there is the My TSC family section, so different family members can be, or multiple family members can be registered into the app. My TSC story is very shortly about some medical aspects of the TSC diagnosis, and then you come to this section, My TAND checklist, which you can see on the third panel how it is set up. So then the user can complete all the questions, can complete the TAND checklist, and then this results in a cluster profile illustrating how different TAND clusters are affected. So in a quantifiable manner. The next step is, of course, the validation of this TAND SQ, and we are in a full startup of this phase of the project, with a lot of contract negotiations and ethical committee submissions, but we're almost getting there. And the validation will consist of the collection of data. On the one hand side, working together with Cincinnati's Children's Hospital and Boston's Children's Hospital, from which we will get anonymized data from the clinical expert research database, so retrospective research database, together with data from the TAND SQ. So these patients from the research database, they will get an invitation and a link to the app, and they can complete the TAND SQ via the app. On the other hand, we will also collect data from patients who are registered in the Tuberous Sclerosis Alliance, or now it's TSC Alliance, a natural history database. So we will get data, more real-life data from the natural history database, and these patients will get a link to a secure platform where they can complete the TAND SQ. So we will compare clinical expert research data, but also data from the natural history database, and we will compare them to completed TAND SQ data, or they are being completed by the app or by a secured platform. So this was about the first aim, the TAND SQ. The second aim is focusing on the generation of consensus clinical guidelines for identification and treatment of TAND. And for this aim, a literature review was performed, on the one hand, very broadly, a scoping review done by Stefanie van Klooster, or led by Stefanie van Klooster in collaboration with Stacy Bissell. And they aim to systematically describe and evaluate the TAND research field and identify knowledge gaps in TAND research that could inform priority setting and guide recommendations for future TAND studies. So they used the methodological framework as developed by Arksy and O'Malley. It was a huge amount of work, but it should be submitted very soon. We're looking forward. So I hope you all can read this scoping review later on in this year. But next to this very broad scoping review, there was also a literature review done per cluster, targeting very specifically the certain clusters. And these review results were discussed in our virtual consensus conference held in November 2020. It should be 2020 and not 21, of course, where we talked about all the results of this literature review and about the next steps. So we had a lot of very serious discussions, as you can see, but also a lot of fun celebrating birthdays. So reviewing the cluster chapters, the literature review per cluster, they had specific summary statements and recommendations, and there appear to be overarching principles applying to all TAND domains and all TAND clusters, and that's what we call the 10 core principles for identification and intervention of TAND, and they will form the basis of the TAND consensus clinical guidelines publication we are working on for the moment. And then interestingly, we found that the recommendations from the psychosocial quality of life cluster are in fact a wraparound principle that we could wrap around at all the other different clusters. So caring for the caregivers itself is so important to be able to obtain optimal outcomes for individuals with TSC. So the quality of life cluster caring for the caregivers will be a wraparound principle. So next to these 10 core principles, we focused on the summary statements and recommendations per cluster, and based on these summary statements and recommendations, we are now building or developing the TAND toolkit. And what is this TAND toolkit? It's in fact a self-help tool, or we want it to be a self-help tool for families, caregivers, and individuals with TSC. So the innovative product from this project will be the app where people can complete the TAND SQ. It's quantified, and they get this overview of the quantified TAND clusters, and they can click through and they come into the My TAND toolkit. And what will be the different sections or sections of this TAND toolkit. First of all, we will start with about this cluster section. It will probably be a short introductory video or a fact sheet about the cluster, making it very TSC specific. So what are the symptoms and the specific signs for this cluster, and explain what resources are available in the next two sections, being what to seek. And in the what to seek section, we focus on assessment, evaluation and diagnosis, intervention and treatment plans, and also which professionals to seek for diagnosis and to seek for intervention. But the following important section is what to do. And there we are focusing on home-based interventions led by parents, families, or caregivers, what to do at home, what to do at school, what to do at work. So for the moment, we are working on populating the TAND toolkit sections with the available interesting resources that are out there, resources that can be used already, and we are identifying the gaps, what new resources would be beneficial, and what resources do we want to develop to make a very nice TAND toolkit that is user-friendly and informative for the patients and their families. And this toolkit will, of course, be integrated into the app. The third aim of this project is the development or the building of a global TAND consortium. And on this world map, you can already see where we are now, being the different members of the TANDem project spread all over the world. And we, of course, want this TAND consortium to become bigger and bigger, having more and more networking activities and capacity building activities later on during the project. So one of our dissemination activities was the launch of the website on the 1st of February of this year. So if you type in TAND Consortium in Google, you will be directed to this website, or tandconsortium.org. And on the website, you can find a lot of information about TAND, information about the TANDem project, a lot of resources, mainly about TAND, of course. You can find all the details of the team working on the project, the partners. And there's also a section where we would love to get tips from everybody around the world, tips regarding the management of TAND elements, of TAND aspects, anything. So I would hereby ask all of you, or warmly welcome you, to submit tips through the website. And another dissemination activity was the launch of a Twitter account, also on the 1st of February of this year. We are trying to be as active as possible, but we're still building our Twitter account further on. But you are very welcome to follow us and to see what we are working on, because we try to post some news items and new elements as we go along, as we progress. So then what are the next steps? What will we do during the remainder of year 2 and year 3 and year 4? And then I go back to the Gantt chart of the project. So we started the project in November 2019. We are finalizing the development of the TAND SQ and building it into the app. And we will probably soon start with the validation phase, collecting data of the TANDem, of course, and compare them to data from the expert research databases and the natural history database of the TSC Alliance. We almost finalized the scoping review and we are working on the consensus clinical guidelines, and we are fully working on the development of the TAND toolkit, which first should be developed and then integrated into the app. And then we will go to a phase of a feasibility evaluation of the TAND toolkit app as a whole, and do the final analysis of all the data collected. Regarding the dissemination activities, so this was placed here at the end, but in fact we already had quite some dissemination activities, being the launch of the website and of the Twitter account as mentioned, but there were also already several abstracts submitted and accepted and presented at different meetings or congresses. And I want to point out that this was not only in the TSC world, but there are abstracts presented in the autism field, also in the child neurology field, in the field of intellectual and developmental disabilities, in the field of other syndromes, and also in the field of child psychiatry. So we are reaching beyond the borders of the TSC community, because this seems to be very important to try and reach as many families, caregivers, and health professionals as possible. So these are all the participating organizations, and I would really like to thank everybody of the team for being so enthusiastic and cooperative. It's always very nice to meet, and I think we all get a lot of energy from these meetings. Hereby, I would like to finish with the link to the website. Please come and have a look, and thank you very much for your attention. We are ready for any questions. Thank you.